Last week, we announced that 7.1 million Americans have signed up for private insurance through the marketplace. As of this week, 400,000 additional Americans have signed up, and we expect that number to continue to grow.
All right, now we can quibble with these health care numbers, but the bottom line is this. More sick people are signing up than people who are not, and we're not getting nearly enough young people, which are crucial to paying for this whole thing. The Washington Free Beacon's Lachlan Markay breaking it all down. That's what's crucial, right? Just who makes up those who are enrolling, right?
Right. It's something we've been concerned about sort of from the beginning of the process, which is that if you don't have enough young or really healthy people, but very often young is a proxy for healthy, if you don't have enough of those people signing up, you essentially don't have people who aren't extracting benefits to subsidize the coverage of people who are extracting benefits. And that's really how insurance works. You have to have enough people who are paying into the system that you could pay money out of the system to people who need that care. So if we don't get enough young people, enough healthy people signing up, you're really going to see a problem from the insurer's standpoint, and very likely hikes in premiums and so on, all the problems that come along with that.
All right, so that's not a good, sort of breakdown going forward. I mean, you need the younger, healthier people. You need healthier people, period. And
right.
If it skews toward, more who need the system and benefits from the system than those who are paying into the system, that is not a good long-term strategy, generally.
Right. I mean, the concern is what's very often referred to as a death spiral, where premiums go up in order to make up for that shortfall of young, healthy people, further discouraging people who consider themselves healthy to sign up for insurance, and instead they go pay the mandate penalty, tax, whatever we're calling it today. So that's really the concern, is that young people who, the young invincibles we very often call them, who feel that they're healthy enough that they don't need insurance, won't sign up, will pay that tax instead, and you won't have that influx of dollars that you need to pay out to the less healthy crowd.
What about this phenomenon where we're getting a lot of people who sign up for Medicaid, or we still don't know how many are transitioning from another government program to that, but that we're not appreciating that maybe a lot of young people are signing through that. I don't think that's the case, though.
Right. Well, you also have to look at, you can't really take the Medicaid sign-up number at face value. You have to look at how many of these are due solely to the Medicaid expansion. So you have to look at only the states where Medicaid is being expanded, and then what's the scale of the expansion in those states. You're really talking only a fraction of some of the numbers that we've seen thrown around from Secretary Sebelius and others. So you really have to drill down to get a more accurate idea of how many people are actually gaining coverage as a result of the law, not just how many people have coverage after the law was passed.
All right. Thank you very, very much. I do appreciate that. I do want to alert you to something.